Hello and welcome. My name is Donna Cryer, and I am the founder and CEO of the Global Liver Institute. Today, I have a very special episode of GLI Live for you. And I know I say that every week, but this is even more special than special. If any of you missed the big announcement last week of the launch of GLI's Liver Action Network, here is your opportunity to catch up on what's happening. It's funny that over twice in the past few weeks, someone has told me, as I've now been out and about, they're like, "Oh, Donna, you're global. This is about the United States. You may not understand." And somebody who has devoted the past quarter century of my career to liver advocacy and health advocacy and patient advocacy in the United States, based right here in Washington, D.C., I sort of laughed at that. And while that's a fabulous nod to our expansion and our partnership outside the United States, we are very much committed to making sure that there are no gaps in advocacy in communities across the United States. But to make good on that, I needed a little help. And so here I have with me the founding members of our Liver Action Network, Scott Suckow, coming to us from the Liver Coalition of San Diego, Teresa Davidson from the Midsouth Liver Alliance, and Farrah Douglas from the Liver Wellness Foundation. Hello.
Hello.
Hi, Donna.
So I just would like to ask, each of you, maybe in that same order, how you became connected to liver health when we first started, where you're located, because some of you are much broader than just where your where your name or title might indicate. So Scott, what areas of the country do you cover, and how did you get into liver health?
Excellent. Well, thank you for having me, Donna. I'm based in San Diego, and we actually cover San Diego County. 24 years ago, when I was working for the American Diabetes Association, I saw an ad in the paper. It said, "Number 2 who wants to be number 1. Apply here." And it was the position for the first executive director's position for the American Liver Foundation's Northern California office in San Francisco. So I applied. They said there's no office here. It was part of an expansion that they had at the time where they started to staff their field offices. And they said, go find an office through this grant from Sharing Plow. You've got enough funding for 1 year, and then you need to be self-sustaining. And that was how I started my relationship with the liver disease community. Interesting enough, 24 years later, because of COVID, I actually was in San Francisco and closed that field office for the same organization that hired me to open it. So although a very sad day for the American Liver Foundation, I think the pivot is where one door closes as an advocate, where are the opportunities? And I think the opportunities are here. I think your leadership and vision, Donna, and commitment to patient voice and the understanding and respect of the role of the community says the community can live, we can thrive, and patients can have a voice. And that's why we're excited to be here under the new name, Liver Coalition of San Diego.
Fantastic. Teresa, how did you come into liver health?
Well, I am in Nashville, Tennessee, by the way. I am with the Midsouth Liver Alliance, and we're committed to improving, educating, advocating, and supporting children, adults, and families impacted by chronic liver disease in the Mid-South states of Tennessee, Alabama, Mississippi, Arkansas, Louisiana, and Kentucky. I came into the liver health space a couple of years ago, but before that, I was in the renal space. And I was with renal disease for over almost 18 years. I was the CEO for the Tennessee Kidney Foundation. And so now after building the Tennessee Kidney Foundation and having that experience, several of the doctors and such asked me to kind of start a Mid-South Liver Alliance in these areas. So that's what I'm working on. I'm working to build board of directors and medical advisory board and members in these states. We have a lot of rural spaces in these southern states, and we really need to kind of focus in on the health disparities and the access to care, because there's a lot of patients that are falling through the cracks. And that's where my love of this comes in, because I really aspire to educate patients more and to help them with some of the needs that they may have in their various areas.
Fantastic. And Farrah.
Yes, hello. I am with Liver Wellness Foundation. I am located in Greater LA area, actually in Redondo Beach. We have an office in Long Beach as well. And I started doing charitable work back 30 years ago. When my husband and I opened our own private business in the city of Carlsbad, San Diego County. And I saw a nonprofit organization, schools coming to us constantly asking for donations. And of course, I couldn't say no. And eventually I came to understand that I can make a living and still be an important part of making things happen in the community. So before I knew it, I was on 10 different local charitable boards, raising funds for them and doing everything I could to help them. So my official background includes a combination of being a business leader, being the chair of the Chamber of Commerce, Carlsbad, and also being an elected official. But eventually, about 9 years ago, I chose where my heart was, which is the nonprofit sector. And I started working at Tri-City Medical Center in Oceanside, San Diego County. We were living there at the time. And eventually found myself in American Liver Foundation in 2015. And as Scott said, it was very hard to close down our offices, especially because some of my board members had been with the ALF for over 25 years. But the reality is these board members did not accept that there will not be a voice for our patients, local voice for our patients, that we will not have a representation. So they have invested and have put together this Liver Wellness Foundation. And back in March of this year, when ALF had to reduce its workforce again, they asked me to join them. And we went live and started working together. We are very dedicated in helping liver patients, providing free educational programs for them, and doing all we can to make sure we can be a relation between the doctors and the patient and help them reach each other. My territory, because I had worked in this area, it's really Greater Los Angeles Division, all its 7 counties. I have on my medical advisory council, we have doctors from Northern California, from Washington, Oregon, and Nevada. And I also have working in Hawaii and Alaska, if you believe it or not. So it's a large territory, but right now our main focus is to make sure that people know we are here. We are here for them, and we are their local voice.
I just want to extend my profound gratitude as a liver patient for all of you bringing your expertise to the community on behalf of liver patients to make sure that we don't lose out, that we don't miss out. We are already so under-recognized, under-treated, stigmatized, and siloed. And so the fact that you brought your expertise from the renal space, from the diabetes space, from entrepreneurship, and chosen to ally yourselves with and lend your expertise to liver patients is something that I am just so grateful for, and I just wish I could just extend that. I hope you feel that across the airwaves, because it comes from deep in my heart.
Thank you.
So what are we gonna do together? So now that we've decided to come together and make sure that there are no gaps in liver health in the United States, that no patient goes served. What are we going to do? There are so many needs. And so, the Global Liver Institute has, in the 7 years that I have been doing this, tried to distill the problems by creating these councils in liver cancer and to organize the cancer space and organizations, the NASH space, which didn't exist before, to create the NASH space, and then in pediatric and rare liver diseases. But we had started in viral hepatitis with working with our colleagues in the National Viral Hepatitis Roundtable, and then since they were so well functioning, we sort of let them have that as we moved on to other areas. But we know that the needs differ based on patients and based on different communities. Teresa, you started to go into some of that in terms of the needs of people in rural communities. And so maybe, let's spend some time talking about, the particular either types of liver disease or the aspects of accessing optimal care, that are unique to each of your localities. Teresa, you started the conversation so well. Do you want to, let's start with you.
Sure. Well, the biggest in the South probably is definitely NAFLD and NASH. Diabetes and obesity rates in the Mid-South states are 35% higher than any of the other states. Thereby, they impact the public health and the healthcare cost. There's over 8 million people in the Mid-South area alone that I have mentioned, the states that we're doing, that are at risk for NAFLD and NASH. And that's why it's important for me to have representation from all states of our medical advisory committee as we tackle this epidemic and help the state health departments as well as other providers understand the importance of treating these patients quickly before they progress to stage 3 or stage 4. To me, that's our important thing that we have to do. Hepatitis C is also important in some of my areas. There's a few pockets that really are having problems with the opioid epidemic and are having causes which help with the HCV as well. So those are the two big areas that I see that we have the need. And again, being in the rural areas, like in Mississippi, I know there's only one hepatologist or one or two hepatologists in the whole state. So you've got a lot of needs in the rural areas that we need to work on.
On one of the International NASH Day panels that I've been preparing, we talked about food deserts and food pharmacies and being able to write a prescription for healthy foods. And I discussed a cardiovascular risk reduction program that I had built in the state of Mississippi, and a lot of it involved sort of mobile farmers markets and bringing healthy foods to to different communities. And so I think there are so many things that we can learn and can add on to, rather than thinking that we have to build from scratch, where we can find in different communities to address multiple aspects of metabolic health. So adding liver on top of initiatives to reduce cardiovascular health and reducing diabetes. And, it's so exciting that all of you have those connections and, get that type of integrated sort of whole person thinking as we address liver health. Farrah?
I think as we do that, we have to realize that we do have to collaborate and work together to make it happen, because it's not something that one group can do.
Right.
It's going to take a team.
And I so look forward to connecting you with the local chapters and physicians that are involved in some of our national NASH Council partners, because
that'd be great
to work, in their own communities and in states. And so, but I always think, and whether this is, building a program in, Africa or Arkansas, that you can't come parachuting in. It needs to be, a physician and a patient champion from that community, defining the needs of that community, and then, going out and bringing that message appropriately to, to their friends and families.
Most definitely.
So Farrah, what are you seeing in Los Angeles and in the states in which you work? What are some of your highest needs?
Greater LA is very different from anywhere else because we have so many transplant centers, so many hepatologists here. But one of the things, even in Greater LA, that I have learned past 6 years has been that disparity in access to healthcare is a big issue, especially in the clustered areas when we have a lot of immigrants or poverty.
Right.
The underprivileged communities. So that has been an issue that I've been working on, trying to figure out how to reach out to these communities and make sure they understand what's available to them free of charge, and what we can do to educate them. We have clusters of Hep C hotspots. Also co-infection with AIDS, that's a big issue. And as Teresa was saying, it goes with also opiate use. It's also lack of cohesive understanding and kind of people feeling they have no power in changing the rules and the laws. So that's one part. Other part of my work has been to make sure they understand that we can influence and bring about patient-friendly legislation. The biggest thing we feel here, well, there are other parts. For example, in Oregon, Washington, one of the things we want to do is to provide seminars and webinars to talk to GIs and primary care doctors. So when they see a patient, they realize what's going on with that patient. Well, the biggest stigma that we face is people still feel those who are suffering from liver disease have done it to themselves. So they don't deserve our help. They don't deserve to be cured. Two segments that we see in Greater LA that's growing as far as liver disease goes is NASH, NAFLD, and that is a big issue. Also, cancer rate for liver is high.
Absolutely. Well, if any of our liver diseases are allowed to progress too long or go undiagnosed, they can cause cancer or the need for transplant. And so, we have to move the care back earlier and the screening back earlier and earlier to hopefully prevent that. So, Scott, you are a policy powerhouse, I know. We're so energized about what we've been able to work with you on already in policy. What are some of the things that are explained as the largest needs in your area, and some of the policy initiatives that you're most excited about?
Well, speaking of the policy, that's one of the great things about being part of the Liver Action Network is we can be all things local and yet have a link to how that implies or impacts national. And so at the federal level, having, kind of you share information to us, like we actually have some meetings coming up that you've organized that we're part of with 2 congressional offices in our district. So we just love the partnership with GLI because it allows us to be knowledgeable about what's happening at the federal level and yet stay true to our local liver coalition in San Diego local base. But our goals are nationally entrenched. So liver cancer is the fastest growing cause of death by cancer in the United States, according to the American Cancer Society. And what are the leading causes of that, and how can we address that locally? So early detection through screening, addressing high feeders into liver cancer, hepatitis C, hepatitis B, NAFLD, NASH, and then more rare liver diseases. So there's a lot of opportunity for us to have a very big goal and to chip away locally what that means. And the NASH rates and NAFLD rates nationally look different based on different communities. In San Diego, we have 47% of our communities are color, and those have higher rates of NAFLD NASH than non-Caucasian white communities. So there's a lot of opportunities for us to target and have a difference. But it's all about partnership. I love the saying of all warriors needed or all champions needed. You can't do it alone. And champions include patient voices. So to close the door, to shut the door, to dampen the voice of patients when the stakes are so high is so not the right way to go. And so, Donna, I just applaud your vision of saying all voices welcome. Patients, providers, caregivers, family members, payers, all of you come together and let's make a difference. And that's why we're here.
Thank you. Thank you so much for that, Scott. My mom will be sending you a check. She keeps a fund so I can have friends. No, I really appreciate that. It is really intentional. A couple of things. Our liver health policy update from the beginning. It was intended for people across the country who don't get up in the morning and read the Federal Register, who don't get up in the morning and have 10 different law firms that they've worked with over 2 decades, feeding them information and highlighting issues. Oh, you should look at this. Oh, this probably applies to you. It was also always thinking, how can I ensure that the voice of an advocate, of somebody who has an experience and knows that something needs to be changed, needs to be different, knows that there is this opportunity to speak, to write, to comment, and how do I make it easier for someone in any community in the country, particularly people who don't do this as their full-time job, to still have a way to express themselves and to make their intentions and their perspectives and their preferences known. I think that's made the liver community so much more powerful than it had been by using our collective voice, but giving people the tools that they otherwise wouldn't have, because they locked away and verified
Right.
here in Washington D.C. or in state houses, it's how do we break that out?
It's interesting. I used to work in the mental health community, and they would say nothing about us without us, right? And so what's meaningful dialogue? So the role for patients, is it just patients as donors? Is it just patients as attendees of our events? Or is it a patient who's invited to the table? Often they leave the table and they co-create the vision for the future. That's nothing about us without us. An equal voice, you're not afraid of it. It's not fear-based. It's saying we value you, you value us. Let's work together as team members with no one part less than the other.
Right.
And I think that's really where we're going to have success, when all parts come together as equal players.
Go ahead, Farrah. Go ahead.
And I think that's what's so different about our 3 foundations that you're talking with, that we have that opportunity now. We have the opportunity to bring the patients in a big way and really listen to them and really understand their issues, rather than just looking at them, as Scott was saying, as money machine, going to them only when we needed money or when they wanted them to come to our events. So that, to me, is the biggest change, at least for me personally, where I am and what I do.
Absolutely. We are adding, on we're calling it a sort of a patient insights position, specifically to, having personally bridged a lot of, listening to people's lived experiencing and making that translation into, okay, that's a policy, that would be a policy solution, applied at, this agency or this level, or we need to, we need more information or evidence on that. So now that's a research question.
Right.
And that's, one of my favorite party tricks, to translate a patient experience into a research question. But to have somebody on board to do more of that and to do that systematically, given the opportunity to work with you, and wanting to be able to, authentically receive all of that insight and experience and information. And, patients are very practical. Patients want action. Patients want change. Patients want to, and I'll just speak from my own experience. It's very healing to me to be someplace or to have someone listen who can actually do something about the problem. So when I sit on the board of a hospital, the fact that things I've asked for or found problematic as patients can now be changed and put into action so other patients don't have to go through that, that's healing to me. And so that's what I want GLI to be. That's what I want this Liver Action Network to be for every patient who participates in it. I want it to be a place of healing, because what they've experienced can now be turned into something that improves the system and makes it better or easier for another family or another person coming through that. And I think collectively we can do that, more powerfully, and let people know they're not powerless. Farrah, to your point, that they can, they do have value. Their experiences have value, no matter what they came through. That they deserve treatment. They deserve, health insurance and pension from their physicians, and and clear care pathways and information and education for them, and policy that supports all of that. We should have that in the same way that lung cancer patients or breast cancer patients or or AIDS patients have. So that's what I feel accountable for and who I feel accountable to, and I know you all do as well. We also want to come to Hollywood, Farrah, and have some.
Oh, please. We love it here. We love it here. And, talking about the stigma and patient's voice, I just met with a 13-year-old girl who was diagnosed when she was 12 years old with autoimmune hepatitis. Nobody had any clue she had it. She just went in for her normal physical exam and came back with this result. And you can imagine the shock and everything the whole family went through. So one of the things I've done trying all past 6 years to move this stigma has been to bring children up.
Right.
Talk to children, have them in all of our events so people can see that innocent children get it. And they haven't done drugs, they haven't done alcohol, but they have liver disease. So that's one way I feel personally that we have tried to fight the stigma of everybody's alcoholic, everybody's drug abuse. So we want to touch them. And the other thing you were talking about the voice of the patient, this 13-year-old has written her life story, which I'll put it on my Facebook. On my website, I'm sorry. And she talks about how important it was to her that the doctors actually addressed her when she was at the hospital. They didn't talk to her mom and dad and ignore her. They talked to her. They told her what was wrong with her, what the treatment they're going to offer, what procedures they're going to. She felt that was empowering to her. And that's her mission. She wants to join me, just talk to young kids and tell them how they can be empowered to be there. Even though they're young enough, they cannot make their own decision, but they are a part of that decision. So that's the patient voice.
Well, you can tell her from my experience that 13-year-olds diagnosed, before the age of 50. So she has a bright path ahead of her if she continues on the advocacy.
On the stigma front, I just want to say that in San Diego, and I think nationally, physicians are saying put alcohol back on the top of the list of the things we talk about. Because when we don't talk about alcohol and its connection with liver disease, and we only talk about the liver diseases that are not alcohol related, we're feeding into the stigma.
Right.
By addressing it head on. So we really want to talk about it as the cause of liver disease, and not shy away from it.
Right. This is the kind of conversation I look forward to us having as we think what is the best way to move forward, because I can see both sides of the argument. Not, no surprise, I'm a lawyer. I can see both sides because we are, for many people, just introducing the idea of liver disease or liver health, and so letting them know that children can get liver disease, that it affects, veterans and grandparents and all of these so-called innocents. Is that a way just simply to introduce the conversation so that we can, the tip of the spear, if you will, so we can bring everybody else afterwards? Or do we just sort of go out, loud and proud, and you have to accept all of us with every condition, and, and we give no quarter to how people, acquired it?
I think we look to our brothers and sisters within the HIV community. And when Ryan White first came out with the funding, it was Ryan White, this innocent child, and everyone was like, oh, I got it from a good way or a bad way. And the community said, no. That's not the way we're approaching this. It doesn't matter how you got it. If you're HIV positive, you're welcome here. Let's have a conversation. And it turned it away from how you got it to what we can do about it.
Right.
And I think from the liver disease community, with so many liver diseases, let's talk about alcohol is one liver disease, but there are many other liver diseases, and really talking about it through an education lens.
I agree. Hepatic Bergen car with license plates, and I don't tell people necessarily, how I acquired liver disease, because I do feel I represent everyone who has a liver condition, no matter how they acquired it. They are deserving of dignity. They are deserving of care, and they're deserving of certainly of our service and advocacy. So,
well, Donna, it's so odd to me that if somebody has breast cancer or lung cancer, not lung cancer, maybe breast cancer, we don't go around and say, how did you get it? Right. What did you do to get it? But when somebody has a liver disease, the first question is, must be alcoholic, must be a drug user, there must be a co-infection between AIDS, HIV, and hepatitis or whatever. So that is the thing that we can work together to change and make sure people understand. The same thing, you don't ask people why they have brain cancer. Right? The same is with liver cancer. Not everything has to be so negatively looked at. We are helping with, look what is happening with breast cancer. It has become such a big issue. Everybody wants to help. Why can't we do the same thing for liver?
I think we shall. And so we close this episode out. This time goes so quickly. One takeaway, or one, let me put it this way. What is one thing that you look forward to accomplishing through the Liver Action Network together? Teresa, I'll let you start.
I think just educating the patients on how to advocate for themselves and what they need to do. To me, being a small one-person shop and working in so many different states, having you to help in the training of that is going to be significant for me, because as they get trained, they can come back to the states and help me with the state issues that we really need to push, because there's a lot down here in the South that we need to work on. And I think that that's going to be very helpful for me.
Absolutely. Farrah?
I agree with everything that Teresa said, and I look forward to working with you and our liver patients. I also, as a former elected official, I know that I had no knowledge of liver when I was a city council member. So I've been educated so much the past 6 years. So legislators are human beings too. And I think GLI and the Liver Network Action can play an extremely important role in educating the legislators by providing opportunities for us and maybe our liver heroes or liver champions that are suffering from it, to sit down and talk with them, because most of them have no clue what liver is, how important it is, how people get liver disease, what are the treatments available, what are the regulations they have passed that is making it harder for liver patients to have access to treatment. So I think you can play a very important role, and we all will help you to educate our legislators, not only our patient, but them. Together, they can make a difference.
Scott, I'll let you have the last word.
Stronger together.
Those are fantastic last words. We are stronger together, and I'm so grateful for all of you and so excited and so optimistic about what we will do together on behalf of liver patients across the United States. So thank you, and thank you to all of you who are watching. Until next time, you can find us on Facebook, on Twitter, on Global Liver, and on Instagram, Global Liver Institute. We'll make sure you also have the versioning websites for our members of the Liver Action Network here, so that you can reach out to them directly. Until next time, stay well and stay connected. Bye.
Thank you.
Thank you, everybody.